here, we are going to use powered instrumentation to show you how it's done with the powered instrumentation. So again, we gently displace the middle turbinate to one side. Then you can see the uncinate process, gate number 1. The space is a bit narrow because of the DNS, that is gate number 2. There's the bulla. Very small space here, so the ethmoid is very small. You can see how the uncinate is very prominent, but the ethmoid is very small, little space behind for the retrobulla cells. And this is the ground lamella, where the middle turbinate moves laterally as well. So on this side, we are going to do a retrograde uncinectomy. And then we're going to use a powered instrumentation all the way. So the idea is we show you how it's done with the cold instruments, how it's done by powered instruments, and how it's done by a retrograde uncinectomy. So you have exposure to, and you choose whichever combination that you like. So a backbiter, slide it in all the way to the top, and then you bite this. So this is a retrograde uncinectomy, and then you can actually remove the top portion. The only disadvantage about this is your tail is still intact. The uncinate tail is still intact. So that's the reason why I always do an antegrade, because that I think is much faster. It's much faster, and you will be able to expose the maxillary ostia much easier as well. So now what we're going to do is we're going to use a debrider, and we're going to remove the uncinate process all the way. Never put your debrider in this direction. It should always face the top like this, or face laterally like this. Okay, so this is gate uncinate being removed. So now we can look at gate bulla. That is the bulla being exposed as well. So what we do is we puncture the bulla exactly at the area that's most prominent, and then we use the debrider to remove the anterior wall of the ethmoid. So with a powered instrument, you get very precise cutting. And once I've done that, now we are having a very nice view of the anterior ethmoids. Can you see how small the anterior ethmoid is? Because of the DNS, the space is very narrow. So now the anterior ethmoid is open. So now we are looking at the ground lamella. So now we are looking at ground lamella. So the same way, if we puncture the junction between the horizontal and the vertical aspect. So now I'm going to the third gate. So now we are now in the posterior ethmoids. Again, remember the anterior ethmoids are many cells, but small cells. And then this is now the posterior ethmoids. So now we have opened up the posterior ethmoids as well. So now we are going to remove. So with a debrider, you can remove whatever structures you need to be removed in a very precise manner. So now we are at we are now into the posterior ethmoids. So that gives us the anterior wall of the sphenoid sinus. And if I remove all the mucosa, you can actually see the posterior ethmoidal artery, and that's the anterior wall of the sphenoid sinus there. And you can also see the orbit as well. So once we enter into this plane, we can actually enter to the sphenoid sinus. We're coming now to the anterior wall of the fourth gate, which is the anterior wall of the sphenoid sinus. And we should be able to enter the sphenoid sinus here. So now we're entering the sphenoid sinus, as you can see. So this is how the entire procedure can be done with a debrider. It's much quicker, with a precise cutting, as long as you know your landmarks and how to use the debrider well. The same way, we can also look for the frontal sinus. I'm putting the scope on the floor, and then we're going to go between the uncinate process and the bulla, the vertical shelf that goes from the bulla to the uncinate process. And if we remove this here, and that should give us a view to the frontal recess at the top there. Okay? So with this, I'm going to stop the dissection